Welcome to July Talking Lymph Live. My name's Jan Douglas and I'm the Managing Director of Moving Lymph. And then the other topic I'd like to talk about tonight is applied MLD for lymphedema therapists. And again, this has to do with the way that the Dr. Voda courses have been reformatted in recent years. I'm going to go through just a little bit of the history of manual lymph drainage, just to show you where applied MLD fits with the whole way that MLD is developed, because it has been an evolution. We know that in 1936, the Vodas presented their techniques to a Paris symposium, and the first therapists that really took up and saw the value in what the Vodas were doing were actually the estheticians. The Vodas had developed their techniques working with chronic respiratory conditions, but it was the dermatologists, the estheticians, who first said, oh, wow, we really need these decongestive techniques. So first of all, Voda became known really for aesthetic work. Then in the 50s and 60s, they were asked to collaborate with researchers that were looking at lymphedema and looking at treatments for lymphedema. So as Foldy and others worked with the Vodas. And this is where we get our protocols for combined decongestive therapy. So this is where the redirecting of fluid came in and the development of the multi-layer bandaging systems that we all now recognise for lymphedema. And so then for a while, then it all became about lymphedema. And if you knew anything about Voda or MLD, you probably thought of it in terms of lymphedema. In the 70s and the 80s, the Gunther and Hildegard Wittlinger, who are there in the photograph with the Vodas, Gunther in particular worked very closely with the Vodas and significantly expanded the range of treatments that they were addressing with MLD, particularly developing drainage of the deeper system in the cerebral spaces, and also transferring a lot of what was being done, you know, with organs and systems into the skeletal muscular system as well. And so a lot of what we're actually learning in applied MLD was developed in conjunction with the Wittlingers. And we can see that that MLD hasn't just really been this completely static therapy since the Vodas developed it. It's actually expanded and grown and come to be used for a much broader range of conditions and encompassing a lot more systems than just the lymphatic system. It's a heavily researched technique, particularly in the 70s and the 80s. Professor Dr. Hutchenreuter did a lot of the work on what we now understand as the very significant act of MLD on the autonomic nervous system. So he talked about sympathicolysis, the reduction in sympathetic tone. When we do MLD, we tend now to talk a lot about autonomic balance when we're doing MLD. He did interesting things like measure borborygmus sounds as an indication of increased digestive activity, again, as a result of this reduction in the sympathetic system. He measured blood flow through the capillary and showed one of the very important features of MLD is that, unlike pressure massage, MLD doesn't increase blood pressure in the capillary. It increases blood flow. We have better nutrition, but without an increase in capillary filtrate, which is really important when we start talking about using these techniques with lymphedema clients. Foldy did research on the inflammatory response and showed that C-reactive protein reduces. And since the turn of the century, we've had more and more papers on other aspects and other notable changes in things like these serum muscle enzymes is one that I'm very interested in, because in thinking about athletes who are recovering from events and things like that, MLD can be a very powerful aid in recovering and reducing those serum muscle enzymes. Okay, so applied MLD itself then. We talk about when we do the level 2 training, we introduce what we call special techniques. These are adaptations of the original Dr. Voda techniques for deeper drainage of the head and trunk. So we do drainage for the cerebral nervous system, for the brain and spinal cord. We've got intensive drainage for intercostal pathways for the paraspinal and parasternal lymph nodes that are draining the lungs. And we've got drainage of the deep abdominal region. We also have another kind of set of special techniques. There's two types of special techniques: drainage of these deeper organs, and then also what we call it, or what you would recognize as a test, treat, retest protocol when we're working in the skeletal muscular system. So we're actively looking for pockets of inflammation and draining them away. And we also, in our clinical reasoning in applied MLD, we also talk a lot about our systemic and collateral effects of lymph drainage, how we can actively increase the lymph system systemically, and how we can work on the unaffected side, on the unaffected side if we're not able to touch the affected side. So our applied MLD treatment protocols, the great thing about these is that they are all completely safe for lymphedema. Even though these are not treatments for the lymphedema itself, these are treatments that can address all of the other chronic and acute inflammation, injury, any other comorbidity that's going on that may be impacting on the lymphedema. So we have effective and pain-free treatments for all our skeletal muscle issues, pain and restriction, post-viral syndromes, and respiratory issues, constipation and digestive issues, autoimmune inflammatory diseases, and a lot of interest lately in MLD for neurological complications, neurodegenerative diseases, neurological pain, and so forth. So if we just look more closely at how we use this for those skeletal muscular issues, as I mentioned, we're going to use a test, treat, retest protocol that allows us to very specifically track down and locate small pockets of inflammatory mediators in all the soft tissues. And this may be in the muscle, it may be in the fascia, the tendon, the ligaments, in the joint capsules. And then we apply MLD, very targeted MLD, to really drain away that little pocket of inflammatory mediators. It has a very profound and immediate effect on pain. We use joint mobilization techniques, so we activate joint pumps while we're doing MLD. And for things like frozen shoulders, we've got some really great mobilization techniques for capsulitis and so forth. So these skeletal muscular, this where we're looking for and treating pockets of inflammation, we can use this for a huge range of things. We can use this to address trigger points, as I've mentioned, things like frozen shoulder and encapsulitis. They're really great for recovery after injury, where people might have been limping or using their body in an unbalanced way to help restore balance. Excellent for recovering from sporting injuries and other things like that. So all of these things, if we can address them with safe MLD techniques, that can all have a positive impact on our lymphedema management as well. Whether the issue is in the lymphedema area or not, MLD is still a great way to address these things with someone that does have lymphedema, because of the systemic effects that we're going to have anyway. So if you've got a frozen shoulder on the same side as the lymphedema, absolutely addressing the frozen shoulder will completely change the lymphedema arm and make your lymphedema treatments much more effective. But a frozen shoulder on the non-lymphedema arm, if you address that, you will also have a positive impact on the lymphedema arm. So it's always worth using MLD to address these types of skeletal muscular issues for people who have lymphedema. Even if it's not in the same area as the lymphedema, it's still likely to be the preferred modality for those kinds of issues. And those images there are from blogs from our level 1 instructor, Kim Bolto, who has written up some of her cases using applied MLD in frozen shoulder, and the other one is in Achilles tendonitis. You may be aware that we recently published a 2-case report on MLD in long COVID. and that this graph in the middle is taken from that paper. We were actually looking at respiratory symptoms, so we're looking at reduction in coughing and sinus issues and things like that, breathing more easily, which we did find. But we also did this, we also took measures on things like fatigue, and this is the Piper fatigue scale. We had 2 clients. You can see both clients, A and B, were scoring quite high on the fatigue scale before the treatment and much lower on the fatigue scale after the treatment. And that red line is there because, importantly, that's on this scale, a score of 4 is where you would consider clinical intervention in the fatigue. So prior to the treatment, they were scoring in that range where that's an indicator for a clinical intervention in their fatigue. After the treatment, they were pretty much scoring underneath that benchmark, so no longer requiring a clinical intervention for their fatigue. So this is a really good example of how MLD can be applied. Again, if it's in the lymphedema area, it can be applied very safely and address these other comorbidities, which will often have a negative impact on lymphedema. I've heard a lot of people talk about the impact of things like the vaccine on their lymphedema. And I'd say that using MLD to address those symptoms would be a great way to approach that. We also have a good paper that was published a couple of years ago on MLD in constipation. And this was a randomized controlled trial. They had 3 groups doing a more what we would, standard abdominal massage, a more mechanical type of abdominal massage, electrical stimulation, and MLD. Was in college-age students, so they're no doubt otherwise healthy. And they measured heart rate, stress response, psychological factors, and then bowel movement duration and frequency. And MLD had the most significant improvement in the those autonomic factors, so the heart rate and the stress response. So all 3 groups had a benefit from their treatments, but MLD was significantly better just on a couple of the measures. So MLD was no worse than any of them. It was there at showing significant improvement on every measure, whereas not the other treatments didn't always reach that level of significance on every measure. So this is something it's great to have trials like this, because those of us that have been using MLD for bowel issues in the clinic, we've just seen this for decades, the significant improvement in bowel function under MLD. And a lot of it has to do with that autonomic balance. We're really helping the body to come into better autonomic balance. We can treat a lot of autoimmune and neurodegenerative diseases. Very often now we're talking about symptom management rather than thinking about, curative or reversing anything. But in a lot of these chronic conditions, symptom management is really important. So we can do deep drainage of our cerebral spaces and spinal cord for things like post-stroke, traumatic brain injury. And these deeper drainage techniques are also, I think, going to show great promise in neurodegenerative diseases. And again, that's the image there is from, you'll find in the Talking Lymph blog posts. We've written up notes from one of our therapists who was an OT. It's an OT in Perth who was working in dementia care. And she was doing a very small amount of applied MLD and noting quite obvious improvements in sleep, digestion, and behaviour. So in that kind of aged care setting or high care setting where dementia and neurodegenerative diseases are a big issue, MLD could probably be quite simply introduced and have quite a profound effect. We have to realise that with these types of diseases, though, that we're really looking at perhaps halting progress or slowing progress, whether or not we're actually going to reverse disease Progression probably depends on a whole lot of other factors. Okay, so the certificate in applied MLD, level 1 and 2. Level 1 now, all the theory is done online, so we don't do it in the classroom anymore, it's done online. We have a 6-week program that we help you through. We recommend about 4 hours of home study, and then we've got a 1-hour tutorial each week. And then there's a multiple choice, which you do online, and all that is done before we come together in the classroom. Level 1 and 2 are 4 days each. So we've got 8 days altogether of our intensive hands-on training, learning the original Dr. Votter method and also how to apply it, all the adaptations and the treatment protocols for this huge range of things that we cover with applied MLD. There are assessments in level 2 on technique, sequencing and clinical reasoning, and the certificate is issued by Dr. Votter Schools International. We also, in our Australia and New Zealand classes, we also have post-course mentoring meetings. So we know that often the true learning happens once you leave the classroom and you go back to your clinic and you're faced with somebody that's got some kind of complex issue or something that you didn't talk about exactly in the classroom, and then what do you do? And so we have these follow-up meetings. So the graduated therapists have 12 months access to the virtual community. Our follow-up meetings are all hosted on the virtual community. So any therapist that's a member of the virtual community can listen in to those follow-up meetings, and the new graduates have access to all of those meetings for the next 12 months, which includes these Talking Lymph Live meetings. I host them on both websites. We've got advanced neck and face, which is focused purely on the face, dermatological conditions, post-cosmetic surgery procedures. And then we have advanced body, which doesn't include the neck and face, it's only for the body. Again, for dermatological issues, think about anything to do with the skin. So stretch marks in pregnancy, scars and wound healing. And also we go through all of those cosmetic procedures that people are now having, you know, augmentations, fat transfers, 360 body lifts and liposuction and all of that stuff. And that's all comes into that advanced body certificate. Okay, so with the way that the certificates are structured now, level 1 is the same for all the streams. You learn all the MLD techniques for the 9 body parts, including the neck and face including the face in the level 1. And so it doesn't matter which stream you're doing, you learn that basic MLD for the whole body in level 1. Then you go on and you add level 2 if you're interested in applied MLD. You add level 3 if you're interested in lymphedema. You add the advanced body if you're interested in the medical aesthetics. If you then are eligible for one of the other streams, you can come back and then just add another one. You don't do level 1 again. So if you've done level 1 and 3, and then you decide that you want to come back and do applied MLD, you just do applied MLD. So we call it an upgrade. So each time you come back, you don't go back and do level 1 again. You just add on your next certificate.